Epidural anesthesia is a type of neuraxial anesthesia. It is commonly used during labor and for pain control during and after surgery. It requires a larger dose of local anesthetic compared to a spinal anesthetic. Epidural catheters can be placed in all three regions of the vertebrae as well as the caudal region. The L3-L4 interspace, shown here, is a common placement for an epidural catheter. Make sure emergency equipment is available in the room, such as suction in case of emergent intubation. You will also need airway supplies readily available. The patient should receive a 1 liter bolus of lactated ringers 30 minutes before the procedure. A neosynephrine or ephedrine syringe should be at the bedside in case of increased sympathetic blockade, as well as lipid emulsion. Here are 2 epidural kits that are commonly seen in the hospital setting. Today we will demonstrate placement of an epidural catheter using the midline approach. Educating and counseling the patient on proper positioning will help facilitate a successful epidural placement. Instruct the patient to sit on the side of the bed, knees drawn up, shoulders down and relaxed, and chin to chest. This can be achieved by placing a chair for their feet, hugging a pillow, or sitting Indian style. This helps open up the lumbar spaces. Before opening sterile gloves, clean patient's back with a chlorhexidine solution or betadine. Open kit in a sterile fashion as shown. Once kit is open, apply sterile gloves in a sterile fashion. Here are the contents of an epidural tray. It will contain 1% lidocaine for skin numbing, your test dose, your epidural catheter, loss of resistance syringe, Tuohy needle, labels.
Here is the epidural catheter. 4 lines equal 20 centimeters, 3 15 centimeters, solid line 12.5, double line 10 centimeters.
Once skin prep is dry, open the sterile drape and place on patient's back. This is also a good time to reiterate to the patient the proper positioning. You may also feel your landmarks again and find the L3-L4 interspace. Organize your kit and put away items to the side you will not use. Braid the glass ampules away from your sterile tray and draw up about 3 cc's of 1% lidocaine for your skin wheel. Also draw up 3 cc's of your test dose, which is lidocaine with epinephrine, totaling 45 milligrams. Then prepare your loss of resistance syringe with air or water or both. Go ahead and unwrap your epidural catheter, uncap your Tuohy needle, and prime the adapter with your test dose, if applicable. This will save time during your insertion. Place a 25 gauge needle onto your lidocaine 1% syringe. Again, fill your landmarks on the patient. And start to make a small skin wheel. Use a small needle as a seeker to find where the bone is, as well as ligament. And take your Tui needle and insert at the skin wheel. About 2 to 3 centimeters until you feel ligamentum flavum. You will go through supraspinous ligament and interspinous ligament first. Remove stylet and apply the glass syringe. If the needle is in ligamentum flavum, the bounce is very firm. Advance very slowly while pushing the plunger until loss of resistance occurs. This is usually very pronounced. Count your markings where you lost resistance. Insert epidural catheter into the needle until the 20 centimeter line is at the end of the epidural needle. Again, this is 4 lines on the catheter. The catheter should slide in very easily. Insert catheter while removing the Tui needle. Once the catheter is exposed at the skin, hold the catheter at the skin while removing the needle completely from the catheter. Leave in about 3 to 5 centimeters in addition to the number of centimeters from the loss of resistance from the epidural needle. Just add these two numbers together. For example, if you lost resistance at 5 centimeters and you leave in 3 centimeters, pull back your catheter to 8 centimeters. Then attach the adapter to the end of the catheter. Get your test dose attached to the syringe. Always aspirate before injecting an epidural catheter. Check for blood or CSF. If both are negative, go ahead and inject your test dose and notify the nurse that you are injecting this. If the patient suddenly starts to feel numb in their legs or has an increase in their heart rate of 30 beats per minute or more, you may be in a vessel or you may be in spinal fluid. You may inject the bolus dose of local anesthetic while they are sitting up, or you can wait until the patient is laying back down. This is usually about 12 milligrams of 0.2% ropivacaine or 0.25% bupivacaine. Go ahead and secure your catheter. This can be done many different ways, so just find a way that works best for you. Once the stabilizer is in place, go ahead and remove the sterile drape. Place a tegaderm over the catheter. Then you may place tape along the catheter up the back and shoulder. Make sure you mark the epidural catheter with the sticker that was in the kit.